Welcome to my channel. After conception, the most exciting experience is being able to feel the baby's first movements. One of the significant signs of healthy baby during pregnancy is the baby's normal and regular movement. If the baby's movements are not normal, it might indicate a potential problem. Different types of movements can occur at various stages of pregnancy. Especially during the last 3 months of pregnancy, an expectant mother should pay close attention to her baby's movement. Sometimes it can be challenging to understand the baby's movements, and pregnant mother can become anxious during such time. So, in this video, I will discuss about number 1. When do the baby's movements start during pregnancy? Number 2. How can you count the baby's movement? Number 3. What are the reasons of decrease in fetal movement during pregnancy? And what should we do if the baby's movement decreases during pregnancy? So, let's get started with the discussion. Pregnancy can be divided into 3 trimesters. The first trimester refers to the initial 3 months or 0 to 13 weeks and is known as the first trimester. The second trimester is from 4 to 6 months or 14 to 27 weeks, and the third trimester is from 7 to 9 months or 28 to 42 weeks. Generally, fetal movement starts after the 13 weeks. However, during this time, the baby is so small that it is challenging for a person to perceive the baby's movement. At this stage, the baby's weight is only around 25 grams. Usually, a pregnant mother can feel the baby's movement between the 16 to 24 weeks of pregnancy. If it is her first child, it may take little longer to feel the baby's movement. In case of first pregnancy, a mother can feel fetal movement between 5 to 6 months or 20 to 24 weeks. If it is her second or third pregnancy, she might perceive the movement a little bit earlier. Generally, in the case of second or third pregnancy, a mother can feel the fetal movement after the 16 weeks of pregnancy. The question is, how can you count the baby's movement when it is normal? It is essential to note that the fetal movement varies from person to person, and different factors can influence counting the baby's movement during pregnancy. However, as per research, a healthy baby is expected to move at least 10 times every 2 hours. If you notice your baby moving around 10 times in a 2-hour interval, you can be sure that the baby is healthy. Now, how will you count these 10 fetal movements? It's not always possible to count movement all the time. If you are 28 weeks or more pregnant, then you should try to count your baby movements 2 to 3 times a day. Pay attention to your baby's movement and start counting when they feel first movement. Keep counting until you reach 10 movements. The best time to count fetal movement is after meals. After breakfast, lunch and dinner, you should try to rest on your left side or 1 to 2 hours and count your baby movements. If you can feel 4 to 5 movements within an hour, it indicates that the baby is healthy. Here, it is important to clarify that by movement we don't mean just kicks. Any types of movement can be considered such as rolling, tumbling, flicking and punching. You can count any kind of movement your baby makes. So, after each meal, try to count any movement you feel from your baby. Keep in mind that the goal is to feel the at least 10 movement within a certain time frame. If you can accurately count your baby's movement, it can help protect both you and your babies from potential danger in the future, inshallah. Now discuss about when does baby movement become difficult to understand or why is there less fetal movement during pregnancy. Here are some reasons. Number 1. Generally, the baby stay attached to the placenta in the mother uterus. If the placenta is attached to the front part of the uterus is called an anterior placenta, and if it is attached to the back part of the uterus is called posterior placenta. When the baby is positioned with an anterior placenta, it may take more time to feel fetal's movement, or it might be more challenging to feel them. However, after 28 weeks, even with an anterior placenta, the baby's movement can be understood as normal. Number 2. Mothers who are obese or have more abdominal fat may find it difficult to feel their baby's movement. In such cases, the baby is still moving naturally, but due to the excess fat in the abdomen, pregnant mothers may have trouble feeling the baby's movement. Number 3. During pregnancy, the baby stays within a water-filled bag known as the amniotic sac, and the fluid inside the bag is called amniotic fluid. The presence of this fluid allows pregnant mother to feel their baby's movement better. If the level of amniotic fluid decreases, it refers to as oligohydramnions, and if it is increased beyond the normal level, it is known as polyhydramnions. The baby's movement might be less noticeable if there is too little or too much amniotic fluid during pregnancy. 4. When the baby is asleep, it typically sleeps for 30 to 60 minutes at the time of during pregnancy. When the baby is sleeping, its movements are usually not felt. 5. If the baby does not grow properly during pregnancy, it's called intrauterine growth retardation or IUGR. Even though the baby's physical growth may be reduced, its movement might also decrease. 6. Another critical reason for decrease the baby movement during pregnancy is a condition called umbilical cord compression. Sometimes the umbilical cords get wrapped around the baby's neck, which can lead to lack of oxygen supply to the baby. As a result, the baby may move less. 7. In addition, if the pregnant mother has diabetes, decreased blood glucose level can also lead to reduced baby movements. 8. In some cases, in a twin pregnancy, fetal movement may be less noticeable. 9. Typically, after 36 weeks, baby movement may decrease slightly. This is because around 36 weeks the baby becomes fully grown and has less space inside the uterus, which can result in reduced movement. Additionally, when the baby's head descends into the mother's pelvis, movement may also be perceived as a reduce after 36 weeks. Now let's move on our last question. What should we do if the fetal movement decreases? If the baby's movement decreases and you are unable to understand them while dealing with other tracks, lie down on your left side and try to count the movement. Sometimes you may notice that the baby is moving, but you cannot feel it is due to the work pressure. Number 2. If you cannot count any movement within the first hour, there is no need to worry. Your baby might be sleeping in the uterus. During pregnancy, babies sleep along for 30 to 60 minutes at a time. So try to count the movement again after another hour. 3. If even after waiting for additional 30 minutes, you are unable to understand the fetal movement, please drink a glass of glucose water or fruit juice, because when glucose level increases in the mother bloods, the baby can experience more movements. 4. Get up and do some gentle walking. 5. Tap your belly gently or rub your belly with your hands. 6. Place a light touch on your belly and feel your fetal kick. 7. If necessary, talk to your baby because they can hear you. Many times after doing this, the baby movements become more natural. If you still cannot understand the baby movements within 2 hours, it is advisable to consult a gynecologist and undergo an ultrasound scan. Additionally, if it happens that today's movements are fewer compared to yesterday and the next day then seem even less, even after implementing the aforementioned step to increase movement, it is essential to promptly seek advice from a gynecologist. The doctor will conduct an ultrasound scan to examine the baby movements, position and heartbeat. They will check for any issue related to the placenta, umbilical cord or any other factors that might be causing the decrease in fetal movement. Based on their findings, appropriate medical treatment can be provided and everything will be fine inshallah. If the baby's movement decreases once or 2 times, there is no need to worry. However, if it is happened repeatedly, you should not take it lightly, and seeking the doctor's advice as soon as possible is necessary. Remember, a decreased fetal movement during pregnancy is never a good sign, and there might be an underlying issue. Especially in the last 3 months of pregnancy, if there is a sudden decrease in the baby's movement, it could indicate preterm labor or possibility of premature delivery. In such case, admission to the hospital and proper medical care might be required. That's why monitoring the fetal movement is so crucial. No more today. Hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.